Dept.com.
A New Orleans doctor who specializes in caring for the elderly took on one of America's largest drug companies, and today he won. The U.S. Justice Department announced a $650 million health care fraud settlement with the drug maker Merck. Katie Moore explains.
I was stirring the pot at the hospitals in 1995, and part of the motivation was patient harm.
In the mid-90s, geriatric physician Dr. Bill LaCorte says he started noticing that the drugs his patients were prescribed in local hospitals weren't the same drugs he prescribed before they were admitted.
That when he prescribed the medication Zantac, which is brand name Zantac, his patients were substituted to brand name Pepcid.
At the time, the heartburn medications were only available by prescription. Now everyone can get them over the counter. Drug company Merck manufactures Pepcid.
Why is the hospital going after the more expensive drug Pepcid and substituting it for Zantac? And then he found that the hospital were receiving deep discounts. They were receiving the Pepcid pills for 10 cents a pill when it was being sold outside for $1.80.
LaCorte and his attorney say even though patients went into hospitals on a cheaper drug, they would leave with a prescription for the more expensive medicine.
And this kind of nonsense where medication gets given to patients only to boost drug company profit and hospital bottom line profit is unacceptable. People should be up in arms.
LaCorte says Merck was giving some hospitals 90% discounts on Pepcid as part of a marketing scheme. In exchange, most of the hospital's patients would be given Pepcid, not a competing drug. That 90% discount is what got the U.S. Department of Justice involved.
One of the largest health care fraud settlements ever achieved by the U.S. Department of Justice.
Drug companies like Merck are supposed to report the lowest prices at which they sell medications to state and federal governments so that Medicare and Medicaid programs get the cheapest price possible.
So if the hospital is getting 10 cents a pill, the government of the United States should be getting 10 cents a pill. And that was never the case.
LaCorte is one of two whistleblowers who initially filed suit against Merck. Louisiana stands to get $3.4 million from the settlement. Dr. LaCorte could make millions more, but says it's not about the money, but patience.
One of them was my uncle, who was tied up because of this problem. And this kind of callous disregard, institutional callous disregard for patient benefit.
Katie Moore, Channel 4, Eyewitness News.
In response to the settlement agreement, Merck released a statement on its website saying, quote, "The settlements do not constitute an admission by Merck of any liability or wrongdoing." Merck believes its pricing and sales and marketing policies and practices were consistent with all applicable regulations and contracts during the relevant time.